right, let's take a look at some of these pressures of what's happening during the cardiac cycle. And then I also want to look at what's happening in our AV valves and what is happening inside of our SL valves. Okay, so again, we are going to start at rest. Okay, and at rest, ventricular and atrial diastole. Remember that your AV valves are open, so I'm going to make those in green. Okay, and our SL valves are closed, so we're going to make those in red. So green means open, red means closed. Okay, so let's just talk about what the different phases of the cardiac cycle before. Okay, so we start out with our passive filling. So we have passive filling. Okay. And then what's going to happen after passive filling, right? We get atrial contraction and we get our active filling. Okay, so what's happening during all of that? All of these stay the same. So we'll just sort of extend this so that it lines up a little bit. Okay. Like so. All right, then what's going to happen after that, right? So remember that after that, what we have is the start of ventricular contraction. So we'll say, oops, ventricular contraction. Okay? And this lasts for a sort of a while, right? But remember that initially, right, we have this isovolumetric contraction where the AV valves close and the SL valves are closed, right? So this phase right here, right, this phase where these two valves are closed, remember that's your isovolumetric contraction. Then eventually what happens is that the SL valves open up while the AV valves remain closed. And what state is that? So when your AV valves are closed and your SL valves are open, blood is moving from the ventricles into the vessels. So this state right here, that is your ventricular ejection. Okay, then the ventricles start to relax, so you enter ventricular relaxation. Remember, at the start of that, what's going to happen is that your AV valves are going to remain closed, right? But your SL valves are then going to close. So we call that phase isovolumetric relaxation. Then the pressure is going to create a vacuum to sort of pop those AV valves back open while the SL valves remain closed. Okay? And so what you enter is, look here, back at the beginning, right? So we're back at passive filling. Like so. Okay? Now, let's imagine that we wanted to map the pressure of, let's just say, the atria. Okay? We're going to start with the atria. Okay? So what's going to happen inside of the atria, right, is that it's going to sort of stay stagnant, and then during this active filling phase, it's going to rise up. Hey, it's going to rise up like so, and then it's going to come back down. And then when the ventricles hit that contraction phase and they snap those valves shut, right, you'll see a little bit of the buildup of the pressure again inside of the atria. Okay, then as we enter sort of this active or the ventricular contraction, right, the atria are going to fill up with blood a little bit so that when we get back here, it can hit that rise in pressure again. Okay, so the pressure inside of the atria is going to rise during that active filling, right, that atrial contraction phase. Okay, so what's going to happen inside of, let's take a look at our ventricles. Let's do the ventricles in blue. Okay, so what we're going to see is that as we sort of come out this way, right, the ventricular pressure is going to rise up a little bit as they start to fill with blood. Okay, but then they are going to sort of relax. The size of them is going to sort of expand, and so the pressure is going to go down, right? And then during that ventricular contraction phase, you're going to see this major rise in the pressure, right around that ventricular contraction phase, and it's going to max out sort of in the middle of that ventricular contraction, and then it's going to start to fall. Okay, and it falls down and it dips to its lowest point during that isovolumetric relaxation. Okay, so then as it starts to relax and then starts to fill with blood again during that passive filling phase, it's sort of going to rise back up. Okay, now what do you think is going to happen inside of, let's do orange, inside of the blood vessels, inside of the aorta? So as we're coming along during this initial phase, the pressure inside of the aorta is going to drop, right? And then during this ventricular ejection phase, it's going to rise up, and we're going to see this rise, and it's going to sort of mirror the ventricular pressure, okay? Because we're pumping blood when we enter this sort of active or ventricular ejection state, right? Once we start to eject the blood, right, it starts to enter the vessels, so the pressure inside the vessels comes up. Right? Then during this ventricular relaxation, right, it starts to come down, it comes down, right? Then all of a sudden those valves, right, are going to snap shut, right? So right here, where those valves snap shut, you're going to see where that blood sort of pools in that vessel, and you're going to get this little uptick in the pressure like this. So that right there is something called the dicrotic notch, okay? And that's an important physiological sort of feature, right? And then it sort of like levels off again, and we can repeat that pattern, right? So make sure that you know sort of what's happening pressure-wise inside of the different chambers. But if we know what's happening to the chambers, and we know the overall condition of the valves and where blood's moving to and from, understanding the pressures shouldn't be overly difficult.